Good evening, everybody. So, meeting again with the Organon session, and we have started discussing about the practical part of the Organon since last 3-4 lectures. Last 2 lectures we have given only to the aphorism number 148 because it is the aphorism where Hahnemann have mentioned the dynamic concept of disease, completely removing the doubt in the mind of the every homeopathic physician that there is some material cause in the production of disease. That thought was completely vanished when he introduced this aphorism, and he explained over there how a disease develops because of the spiritual dynamic entity, and that aspect he tried to explain over there. The disease expresses in 2 forms, either acute or chronic, and he explained over there the acute diseases leads to a treatment imperceptibility. Person never understands when the disease disappears, and it happens within few hours after administration of the medicine. But things are rather different when you treat chronic disease. And he explained very thoroughly over there. In chronic diseases, the disease never disappears imperceptibility, but definitely with some little discomfort to the patient. With the same medicine in different potencies, or sometimes with many medicines in succession, depending upon the state of the person. So he has clearly mentioned over there that one single dose of the remedy is not sufficient to treat the chronic diseases or generally the pathological diseases over there. Here you have to treat those either with one remedy with indifferent potency if the state remains same, and if state remains to change every time, you have to change the remedy also in different potency. So that aspect we have learned in thorough in last 2 lectures, and there is a big footnote to this paragraph. This footnote gives you a lot of things. There are many concepts which he has mentioned over there, and how in homeopathy, when you are dealing with the chronic cases, how hard work it is, why it is hard work, why it takes a long time. All those things he has answered over there, and at the same time, he compared it with the allopathy. So let us go ahead with the footnote to paragraph number 148. But this laborious means hard work. Laborious means hard work. But this laborious, sometimes very laborious, search for and selection of homeopathic remedy, most suitable in every respect to each morbid state, is an operation which, notwithstanding all the admirable books for facilitating it, still demands the study of original sources themselves, and at the same time, a great amount of circumspection. Circumspection means durdarshipana. Circumspection and serious deliberation. So, serious deliberation means careful consideration. It means careful consideration. And serious deliberation, which have their best reward in consciousness of having faithfully discharged our duty. How could this laborious, care-demanding task, by which alone the best way of curing diseases is rendered possible, please the gentlemen of the new Mongrel Sect, who assume the honorable name of homeopathist and even seem to employ medicines in form and appearance of homeopathy, but determined upon them anyhow, and who, when this unsuitable remedy does not immediately give relief, in place of having blame on their unpardonable means akshamya, ज्याला क्षमा करता येणार नाही असं, ignorance म्हणजे अज्ञान, ignorance and laxity in performing the most important and serious of all human affairs, ascribed it to homeopathy, which they accuse of great imperfection. If the truth be told, its imperfection consists in this, that the most suitable homeopathic remedy for each morbid condition does not spontaneously fly into their mouths like roasted pigeons, without any trouble on their own part. So what he mentioned over there, when you are dealing with the chronic diseases, it is a hard task because unless and until you understand the patient clearly, it is not possible to find it out a remedy for that patient. Every chronic disease, generally when it is either a psychotic, syphilitic or psychosyphilitic miasm, not psoric. Psoric gives you a lot of symptoms, but psychotic and syphilitic, they comes with you with pathologies. Generally, they suffer from one-sided disorder. Means they are having very few symptoms. And if such types of patients comes to your OPD, it is a hard task. You have to understand that patient from different aspects. You have to understand remedy for that patient, not for his pathology. But to understand human being is a big task. It is not so simple to understand the human being. You have to take into consideration the 7 points which are explained in the aphorism number 5, how to deal with the fundamental cause. Anyone knows? We have discussed those in detail. So those are very, very important. The first point which is there, the ascertainable physical constitution of the person, that you have to take into consideration, with which you can understand the human being. Then second important point which he has explained is related with the mode of living and habits. That is another important point which details about the patient. The third important point is about his occupation. So that is third important point which you have to take into consideration. It is not simple occupation, but what effect the occupation is having on the mind of that person, on the nature of that person, his moral and intellectual character. That is the fourth point, which is very essential to understand that human being. So these are the points which is the age. Then he explained about the age, then his domestic and the social and domestic relations. Then lastly, the sexual functions. All those 7 points defines you exactly the nature of the person. But to understand these 7 points, it requires 1 hour, 2 hours time. It is a hard work. When you are dealing with the pathologists, it is always considered to be a hard work. So when I deal with the cancer patients, I generally gives them 2 hours period. So I keep my appointment at 11:30 and I keep total period up to 1:30 for this, because it is not so simple to reach to the simillimum in such types of cases. Or if I am dealing with the avian cases, it is not so simple task to deal with them. So unless and until we understand that human being, it is not possible to reach to the simillimum. And this is the hard work. People want shortcuts. And that's why they runs behind the shortcuts. In homeopathy, you can't, because you have to treat the human being and not his parts. You have to treat the whole human being. You have to understand that human being for that purpose. And when you have to understand that human being, it is always a hard work. So first important quality the homeopath should born is his rubric should be industrious. He should be very hard worker. And unless and until he is a hard worker, it is not possible to deal with the chronic cases. The pathologies, when you are dealing, you require this type of hard work to take detailed case of the person. Understand that from every aspect. But what happens many times in the modern era, no one is having the time. Then some allopaths, some homeopaths, because of just a fashion sake, that homeopathy is showing its importance, they start homeopathic practice. They have not learned the homeopathy in detail. They have not done the hard work. They don't know how to deal with the chronic cases in detail, and they prescribe some remedy. If the remedy never matches, it never works. And then blames the homeopathy. They blame homeopathy is like that. Either it works or either it don't work. This blame on homeopathy is actually a wrong aspect, and that's why Hahnemann explained, or Hahnemann labeled them directly by the name of Mongrel Sect. Then these people start blaming homeopathy and starts giving allopathic drugs to those patients. This is the reason behind that. These peoples are not at all hard workers. They never spends time with the patient. They never ask details. They never goes for finding it out a remedy in the repertory, in the materia medica. Never applies the principles of Organon. They never learns the principles of Organon. And they want shortcuts. How can it be possible to get results in such types of pathological diseases? And these people starts blaming homeopathy, gives allopathic medicines to the patient for the patient's sake, and then Hahnemann labeled these are the persons, they are criminal treason against divine homeopathy. That word he has used when he has written the 53 aphorism. At the end, last line of the 53 aphorism was that they are nothing but the 52 aphorism. Last line of 52 is they are criminal treasons against divine homeopathy. This word he has used for them only, those who used to practice according to the patient's sake and never goes into doing the hard work over there. So this is the problem which happens to be there with such homeopaths who used to practice allopathy. What he further says, they know, however, from the frequent practice, how to make up for the inefficiency of the scarcely half homeopathic remedy by the employment of allopathic means that come much more handy to them, among which one or more dozens of leeches applied to the affected part, or little harmless venesections to the extent of 8 ounces, or so forth, play an important part. And should the patient, in spite of all this, recover, they extol म्हणजे स्तुती करणे, extol, स्तुती करणे. They extol their venisections and leeches. And alleging म्हणजे एखादी गोष्ट ठासून सांगणे. Alleging that had it not been for these, the patients would not have been pulled through, and they give us to understand in no doubtful language that these operations, derived without much exercise of genius from the pernicious routine of old school, in reality contributed best share towards the cure. So they don't use their intellect, they don't utilize or they don't work hard for those patients. And generally, when they never get the results with this half selected or partially selected simillimum, then they apply allopathic measures. What do they do? During Hahnemannian time, there were methods of applying the leeches. Applying the leeches to the patient never requires an intelligence. It shows that leeches are more intelligent than the human being, because they labels that leeches sucks only the impure blood. So it means that leeches are more intelligent than the human being, and they sucks only that impure blood and patient will be settled. Such types of methods were prevalent at that time and even now also. Second important thing which he has mentioned, that bloodletting, taking the cuts on the body and removing the blood, it never requires intellect. It requires only art to take the blood of the patient. So they keeps their intelligence beside and they starts working on those principles. Luckily, if the patient survives because of these measures, what do? They say that I have applied leeches, I have taken the blood of the patient, and that's why your patient is cured. They start extolling this specific method which they used in the patient. So this is the way they work, and to them Hahnemann labeled by the Mongrel Sect. But many a times, what happens? The patient never recovers. He enters exactly to the opposite side. He becomes more debilitated, and many a times he died because of it. So at that time, what do they do? Then that also he has mentioned over there. But if the patient die under the treatment, as not unfrequently happens, means frequently happens, as not unfrequently happens, they seek to console the friends by saying that they themselves were witnesses that everything conceivable had been done for the lamented deceased. Here deceased means dead. काय म्हणतात ते लोक? I have done each and everything. I have applied the bleaches. I've taken the blood of the patient. Everything possible I have done. But his disease was so serious that he died. This is how they console the relatives of the patient. And they used to use very big words. The patient was having such and such disease. We have done all, but nothing was there in our hand. All those things. Who would do this frivolous and pernicious tribe the honor to call them after the name of very laborious but salutary art homeopathic physicians? He has put very typical question to end with this footnote. He says that who would do this frivolous? Frivolous म्हणजे क्षुल्लक. कुठली गोष्ट गंभीर नसलेले क्षुल्लक गोष्ट. फ्रिओलस अँड पर्निशियस ट्राईब. ट्राईब म्हणजे एक ट्राईबचा अर्थ आहे एकाच मतप्रणालीचे लोक, म्हणजे एकाच दिशेने विचार करणारे लोक. Who would do this frivolous and pernicious tribe the honor to call them after the name of very laborious but salutary art, the homeopathic physician? अशा लोकांना होमिओपॅथिक फिजिशियन म्हणायचं. How can it be possible to label them with the name of honorable name of homeopathic physicians who used to suck the blood of the patient? Hahnemann says this is not homeopathy. Homeopathy, where you might require laborious work, hard work, but it will not going to cause damage to the patient. In fact, it will cure the patient. And to conclude this footnote, what he says, may the just recompense means परतफेड करणे. May the just recompense await them that when taken ill, they may be treated in the same manner. What he said, if you are considering that patient is cured with such type of method, if you are ill, you do the same for you. This is the only treatment for you. So he says that those homeopathic doctors who use such types of methods, for their treatment, they should use similar method. That will be a only punishment for them. So he concludes that footnote with that specific sentence. So what he wants to explain in this sentence, he wants to explain over there, you must do a very hard work. Specifically when you are dealing with the chronic cases, it is a hard work which is needed, with which it is possible to find it out the right remedy. So if there are many pathologies with which patient comes to you, many times rheumatism is big entity. It is not entity which yields very easily. Many times the symptoms of the patient are hidden because he has already consumed a lot of allopathic medicine and then he comes to you. The person was having 10 years of it. Since 10 years he is having the rheumatism and he comes after 10 years of allopathic treatment. And then his main symptoms are hidden. Now he comes in fixed flexion deformities. That there is a jet deformity of thumb, there might be a swan neck deformity of the fingers, there might be a fixed flexion deformities of the extremities. And if such patient comes to you, then he explains that yes, this is the problem, treat that. It becomes rather a difficult task to treat such types of cases. In fact, it is your duty to tell them that it will require long time to take the treatment if you want to come out of this situation. Because it will not going to yield with single dose of the medicine. It will not going to yield with one medicine, but here successive medicines are required in order to bring that patient out. And such types of difficult disorders are not easy to treat. Hahnemann explains over there, it requires really a hard work to deal with the chronic disorder. So acutes are very easy because symptoms are very clear. So patient comes directly and patient says something and you find it out a remedy very easy. But in chronic, it is not so simple. Specifically the chronic with pathological conditions, it's not so simple. So we have to do a big job to learn more and more about medicine, to learn more and more about the materia medica, more and more about repertory, more and more about the organ. Then it is possible to understand that human being with all its perspective, to find it out a right simile. So 148 aphorism, sorry, one footnote to 148 aphorism deals with very specifically with these aspects. For students who are exam going, for them, Mongrel Sect is the short note which is generally asked on this topic. Prepare that with this reference, that footnote to 148 aphorism, or it is 106 footnote. You can mention the reference over there. Tomorrow we'll start with the next aphorism 149. Today we'll conclude over here, and if we have a discussion, there if there are any questions we can discuss. And my suggestion to all of you, today evening I will going to take practical session on Kent's repertory, how to think about the patient, what is needed, what is important. There was one question asked by Dr. Amit Nagvetkar yesterday that, sir, take one session on elements from, we have to learn what is the importance of elements from. So today I will going to take that, be there along with your Kent's repertory, and in your mobile, if you have synthesis or a hard copy of synthesis, that should be along with you. That will be useful for you. I will be there exactly at 9 o'clock, and we'll have a more practical aspect of that session. And ask everyone to join, because this is a free session for everyone. Take the benefit of it. So, any question? Yes, Dr. Benazir.
Good evening, sir. Sir, regarding this footnote, nowadays diabetic is more prevalent, and people came with taking more than 10 years anti-diabetic, as you said, for rheumatoid. They are taking anti-diabetic medicines for more than 1 decade and came to us with a complex disease without any clear-cut signs and symptoms. Please give suggestion how to deal with those chronic diabetic cases.
Basically, whenever the patient chronically diabetic comes to you, at that time, generally, you have to take into consideration all the details of the patient. Here, the remedy which you have to find it out on the basis of whole aspect, you have to consider the miasm. Generally, the miasm is psychosyphilitic, psychotic, or psychotubercular when diabetes is there. Generally, it is most common miasm is that. Second important thing is that when you are dealing with such types of patient, don't directly stop the allopathic medicines at that time. If patient is on insulin, you should not immediately stop the insulin. You start reducing it gradually when you start homeopathic remedies. But basically, when you deal with the diabetes, my suggestion is that you always take into consideration the diet and daily regimen of the patient. That matters a lot in diabetic patient. Many times we can stop the insulin if we properly guide them how to go ahead. Then we can stop his insulin, or it can reduce the dose of insulin. Many times you can stop the allopathic medicines also, but it is a gradual process which you have to follow. Second important thing, if you exactly explain them about the diet and daily routine, then you start your homeopathic medicines. I will share one case. She was a case of, in fact, she was a case of metastasis towards whole body after the mastectomy. Patient was from Andhra Pradesh, not from Calcutta, Dhamabad, and patient was just for the checking. She went to Mumbai to show her doctor after 5 years of mastectomy and chemotherapy, and he just taken a PET scan and he found that whole body there were metastases. They got reference over there regarding mine. They called me on the same day. Next day, they have arranged a video call and video consultation. And I have started the treatment on the same day. She was so obese, 96 kg of weight, having hypothyroidism, having diabetes, insulin dependent. Her dose was 14, 14, 16. So 14 in the morning, 14 in the afternoon, and 16 in the evening before dinner. That was the dose of insulin along with 2 anti-diabetic tablets. and it was not getting control. And along with that, she was having hypertension and then this metastasis, everything, and they called me. I took her case, I talked with her. It was very difficult for her to sit in a chair, that much obese she was, very short stature. What she said was very important for me. Doctor, kuch bhi hone do. It was taken in month of February, and she said, मुझे तो मेरे डॉक्टर साहब ने बताया मैक्सिमम 3 months you can live, बट मुझे दिसंबर तक कैसे भी लेके जाओ, मुझे दिसंबर तक लेके जाओ. सो शी वॉज वेरी, मुझे डांस करना है, मेरी लड़के की शादी है, उसमें डांस करना है. I took her case. I explained the whole thing. I explained how to reduce the dose. And I have explained whole diet, that you have to take diet only for 2 times. I explained that when you will take the first dose, reduce your insulin to half. So instead of 14, you take 7 units in the morning before lunch. Don't do a breakfast. Instead of that, you prepone the lunch and take 7 units. And then in the afternoon, check the sugar first and then only take the half dose of insulin. Otherwise, don't take. She called me in the afternoon. Sugar was very normal. In fact, it was below. I said, no, don't take insulin. Again, in the evening, I asked, first do the sugar and then take the next dose. Evening sugar was again normal. So I have not asked her not to take medicine. Just take dinner. Next day morning, again I have checked. It was found to be normal. And the same day it was stopped. And thereafter, she never required the insulin throughout. She never required any anti-diabetic later on. She reduced 6 kg of weight within first month. Her husband have taken her directly from Calcutta to Sangamner to tell me, doctor, this has happened first time in life. We are trying 10 years to reduce our weight, but this is first time this has happened. And you reduce the insulin, you stop the insulin, you reduce the diabetic doses, and still her sugar is normal. That's why I brought her over here. And thereafter, she survived for 4 years with the help of homeopathy. So this is too important that you have to ask the patient in a proper way. Daily routine and diet plays very vital role in treating the diabetes mellitus. And again, gradually reduce all those doses of insulin and tablets for them. But your concentration should be exact to find it out a right remedy for the patient. If remedy matches, then it works beautifully. Your remedy selection should be very clear in such types of cases. So whenever you are dealing with the chronics, you have to find it out a right remedy. Give the time to the patient when you are dealing with such types of complex disorders and understand that patient from all aspects. Maximum time, my suggestion is that repertorize those cases. It will be very useful for you because repertorization gives you finer differentiation between the remedies. And we never miss perfect remedy because of repertorization. So this is my suggestion to you. We'll discuss about diabetes whenever time permits. I will have a session on diabetes, how to handle diabetes with homeopathy. So that's all for your answer. If you have any
Thank you, sir.
Okay, so thanks a lot.
Thank you, sir.
Have a
Thank you.
session 9 o'clock and do please be there and ask your friends to join. It will be a good session for everyone. Little bit basics for basics I will going to take, but I will going to take what one should look for. What is important in the case that is more important. So we'll meet at 9 o'clock. Thanks a lot. Have a good evening and good night, both things.